Welcome and thank you for taking the time to watch this Choose VA video presentation. As we continue the presentation, please take a few minutes right now and start your VA healthcare application. Just scan the QR code on your screen or click the link in the description below. We're going to spend the next several minutes walking through what VA healthcare can do for you, clearing up some common myths, and showing you exactly how to enroll. Let's get started. No one knows veterans better than we do, and that's not just a tagline, it's the whole reason VA healthcare exists. When you enroll, you're not signing up for generic healthcare. You're signing up for care that's built around what veterans actually need. That includes regular checkups, specialist visits like cardiology, podiatry, and mental health care, home health services, geriatric or elder care, care in the community when you need it, and urgent care access at over 3,000 locations nationwide. You'll also have access to prescriptions, prosthetics, and medical equipment. These are benefits you've already earned through your service. We just want to make sure you're using them. Now, let's talk about where you can actually receive this care, because we know convenience matters. The Birmingham VA healthcare system has a main facility located in Birmingham on 19th Street South, plus a wide network of community clinics across the region. That includes locations in Irondale, Oxford, Bessemer, Childersburg, Guntersville, Sheffield, Jasper, Gadsden, and 3 locations in Huntsville. So wherever you are in central or northern Alabama, there's a good chance there's a VA clinic closer than you think. Keep this video link handy for the full list with addresses, or visit our website at www.va.gov/birminghamhealthcare/. Myth versus fact. This next part is important because we hear the same myths over and over again, and they stop good veterans from getting care they've already earned. Let's clear a few of these up right now. Myth number 1, I didn't serve in combat, or I wasn't injured, so I'm not eligible. Fact. If you served in the active military, naval, or air service, even during peacetime, and you were separated under any condition other than dishonorable, you may qualify for VA healthcare. Myth number 2, I don't want to go to the VA because I want to save appointments for veterans who really need them. Fact. It actually works the opposite way. Our funding is based on the number of veterans who use our services. When you choose VA, you're not taking a spot from someone else. You're helping expand access for every veteran. Myth number 3, I want to go to the VA, but I don't want to lose my private health insurance. Fact, you don't have to choose. If you're eligible, you can keep your private insurance and have VA healthcare too. It's the best of both worlds. Myth number 4, I make too much money, so I've never applied. Fact, eligibility isn't just about income. There are several other factors we look at: service-related conditions, time and location of your service, and more. Don't assume you're disqualified. Apply and let us make that determination. Myth number 5, I already have a service-connected disability rating, so I'm already enrolled in VA healthcare. Fact, unfortunately, that's not automatic. You still need to apply for VA healthcare separately. The good news is, having a service-connected disability is actually a qualifying factor that can help your application. If you've been holding back because of any of these myths, this is your sign to go ahead and apply. Everything you need in one spot. Here's the bigger picture. VA's comprehensive healthcare services can improve your health and well-being while saving you thousands of dollars a year. And here's something worth thinking about. Even if you don't need this care today, you might need it tomorrow or next month or 20 years from now. Once you're enrolled, you have access for life. You don't have to requalify every time your health changes, and veterans trust us. In fact, 93.6% of patients said they trust VA for their health care. We'd love the chance to earn that trust from you too. What could VA healthcare mean for you? Let's get specific about what's actually included. You get comprehensive health care, everything from preventive checkups to specialty care. You don't need separate insurance to use VA care. Whatever your doctor recommends is what you get. You'll have access to vision and hearing care, exams, glasses, contacts, and hearing aids for those who qualify. And you'll have support for mental and whole health because we care about your overall well-being, not just physical symptoms. There's more. You'll have urgent care access at over 3,000 locations nationwide, so you're never too far from care, even when you're traveling. You can do virtual visits and see VA providers right from home. No need to drive in for every appointment. Prescriptions are made simple. They can be filled at your visit or mailed directly to you, with easy refill options. And the VA Health and Benefits app puts it all in your pocket, schedule appointments, refill prescriptions, and manage your benefits right from your phone. A few more things you should know. Travel reimbursement is available. Eligible veterans can actually get paid back for miles driven to and from scheduled appointments. Check-in is easy. No stacks of forms to fill out. Just bring your VA ID. If VA care is too far away or not available for a specific need, community care lets you be seen by providers in your own community. And dental care is available for those who qualify. Eligibility. So, who exactly qualifies? Your service matters, and so does your health. If you served in active military or in the reserves or National Guard and were called to active duty by federal order and completed that service even during peacetime, you may qualify for VA care. The best way to know for sure is to check directly. You can check your eligibility at va.gov/healthcare/eligibility. It only takes a few minutes. What you'll need to enroll. Now let's talk about how to actually get this done, because the process is simpler than a lot of people expect. Before you start your application, it helps to have a few things ready. Your discharge papers, also known as your DD-214, your most recent tax return, social security numbers for you and any dependents, and your insurance card details if you have private insurance. If you don't have all of these on hand right now, that's okay. You can still start the application and finish it later. You can learn more at www.va.gov/healthcare/how-to-apply. How to apply? Let's walk through your options for actually applying, because we want to make this as easy as possible. Apply online. Go to va.gov/healthcare/apply for healthcare form 1010EZ/introduction. This is usually the fastest option. Apply by phone. Call us toll-free at 877-222-8387, and one of our representatives will walk you through it step by step. Apply in person. Visit any of the clinic locations we mentioned earlier. You can find hours and details at www.va.gov/find locations. Apply by mail. Download and complete VA Form 1010EZ, the application for health benefits, and mail it to the Health Eligibility Center, P.O. Box 5207, Janesville, Wisconsin 53547, 5207. Pick whichever method feels most comfortable for you. They all lead to the same place. After you apply. So what happens after you hit submit? You won't be left wondering. Within about a week, you can expect a welcome call to help schedule your first appointment and answer any questions. No waiting, no wondering what's next. A confirmation letter outlining your next steps, and a VA benefits handbook that walks you through your coverage, any copays, and your priority group. And if a week goes by and you haven't heard from us, please don't just assume something went wrong. Give us a call at our toll-free hotline, 877-222-8387, TTY 711, and we'll get you sorted out. That covers the essentials. Before this presentation ends, here are a few resources you will find useful. va.gov, your starting point for requesting military service records and managing your VA benefits and health care. The VA Welcome Kit at va.gov/welcome kit. This is a great overview if you're new to VA benefits. The VA Health and Benefits app. Manage your care, benefits, and payments right from your phone. And of course, if you're local to us here in Birmingham, you can always reach the Birmingham VA directly at 205-933-8101 or email vhabir benefits@va.gov. For general enrollment help nationwide, VA's Health Enrollment Center is available at 877-222-8387.